Hi, welcome to another episode of Talking with Docs.
I'm Dr. Brad Weening.
I'm Dr. Paul Zalzal. Talking with Docs, where we basically talk with docs. Today it's just the two of us talking.
Two docs.
We were going to do Talking with Doc, but it was very boring to hear one person talk, so we decided to do Talking with Docs with more than one doc.
Okay.
We got a cool topic today. This one has some personal annotations, connotations. Close to my heart.
Yes.
We're talking about the side effects of a certain type of medication, and the side effects of that medication that we're talking about is statins.
And I bet if we said side effects of medication, like if we Google that term, statins might come up.
Statins comes up. Okay, so this, and we were inspired to do this talk because a lot of our viewers left some comments on some of our other videos where we talk about cholesterol and talk about the use of medications.
Some kind comments, some productive comments, some really angry comments.
That's
and
fine.
The reason for that is because of the pharmaceutical industry, which has not historically been totally transparent or honest. I think generally speaking, their goal is to do good. Yeah. But it is still a business, and the business of statins is a big one. There's a study that reviewed statin consumption and sales between 2002 and 2018 in the U.S. to an average yearly sale price. Wait for it. $24 billion. Billion, that's a B. So that's a lot. That's a lot of money. It was like 22 million prescriptions in a country that has like 330 million people. So it's a big deal. And recently there have been some articles, one that we're going to do a little journal club on soon, that have called into question, A, how low does our cholesterol have to go? How important is the LDL-C? How important is that? And how significant is the benefit of taking a statin? So we're acknowledging the fact that this is an evolving area of science. Mm-hmm. It is not an exact one. So definitely before you make a decision to not take a statin, you definitely should review this with your family doctor, your cardiologist. And we're just talking about, hey, if you are going to take statin, these are some things that you may be presented with. Yeah, and statins, as you know, are medicines that are used to lower cholesterol. Right. We're not pro-pharma, we're not against pharma, we're just Nutri-pharma. and statins block a substance that is required by your body to make cholesterol. So a lot of the cholesterol that we have in our body is made by our body. Yeah. So the statin stops the ability to make more cholesterol. So it reduces production as opposed to getting rid of it. That's right. It like a lot of the other things. That's right. And it's important, before we go into this topic, to mention an interesting phenomenon. Now, you've all heard of the placebo effect. Yes. Right? And placebo just means, I think it's Latin. Is it Latin? Yes. Pleasing or pleasant. Accepting, yes. Try it as a compliment next time you see someone. You're very placebo. I don't know if it'll work, actually. Don't try that. But anyway, so placebo effect, as you know, is basically the effect where someone perceives a benefit of a treatment just because they're on the treatment, not necessarily because of the treatment. Right. Okay, and the placebo effect, we've talked about this before, is significant. It's up to 30% in some studies. 1 in 3. Yeah. And that's great. You know what I mean? Because they want to get better. You want to get better, you're taking a pill. It could be a sugar pill or a placebo pill, and you do perceive some benefit. Right. Is that a bad thing? I don't think so. I think if you're feeling the relief or an effect, that's good enough, whether it was from the medication or not. It's controversial, right? It's funny. And it's, the placebo effect we always think of as, a pretty good thing if you're getting some relief. Right. Now, like everything in the universe, there's balance. So the placebo is a good thing. The opposite of it is the nocebo effect. That is not a very common word. Not a common word, but nocebo. It is a thing. It's a thing. Okay. It's placebo's evil twin sibling, and they were separated at birth, like an anime movie. Then they get reunited in the second act and battle it out in the third act. Like Cain and Abel. There you go. So the nocebo effect is perceiving harm because there's a risk of harm from it. Okay, so by nature of us presenting you with the side effects of statins, a certain percent of viewers will feel these side effects. Sure. Even though you maybe don't even have them. Even if you don't have them. But if you feel it, does that mean you have it? Kind of. Certain ones anyway. So certain subjective side effects, because of the nocebo effect, you will perceive that you have them. Right. So, keep that in mind. And that's a problem, because whenever we
administer a treatment, we always want to talk about the risks and the benefits.
Sure.
So when we talk about the benefits, we do run the risk of inducing the placebo effect of those benefits. Whenever we talk about the risks, we do run the risk of inducing the nocebo effect.
Well, to be honest, I think with particularly having knee replacements, we talk a lot about risk of blood clot. We worry about it a lot. We're really careful about it. So I think a lot of people come in, and I'll see them regularly. I think I have a blood clot. And I'm like, yeah, you might have a blood clot. And then we do an ultrasound or something to rule out. And most often they do not have a blood clot.
Yeah.
But I think you plant the seed so everyone's it's hyper aware.
Well, on the knee replacement topic, we do tell a lot of people that some people still have pain after the knee replacement and aren't happy.
You might not be perfect.
So, like, are we inducing that outcome by telling them about it? Possibly, according to the nocebo effect, we are inducing a certain percentage to have a bad outcome by telling them that a bad outcome is a chance. However, we have to give informed consent to get it. We have to get informed consent, so we have to tell you about that. So, keep that in mind.
Rabbit hole.
Keep that in mind when we're talking about these side effects, that just by the nocebo effect, some of you may experience them just because we just said it. And that's a thing. I think in 2013 in Britain, there was a media release on the side effects of statins.
Yeah.
And based on a study, then all of a sudden the reported incidence of side effects went way up.
Makes sense.
And the use of statins went down.
Sure.
And that's maybe not a good thing.
Right.
So anyways, placebo, nocebo, keep that in mind before we talk about this.
Okay, so quickly before we talk about the specific side effects of statins, we're going to talk about some risk factors that increase your chances of experiencing some of these side effects. Okay, so there's 7 of them. Number 1.
High dose. If you're on a high dose of the medication, then your chances of having a side effect of that medication are higher. That makes sense.
Okay. Number 2 is if you're taking multiple cholesterol medications. So if your cholesterol doesn't go down with one, sometimes you'll be added a second or a third, just like blood pressure. This increases your chances of having a side effect, probably because it's like having to do more stuff to your body.
Next one is increased age, right? If you're over 80, there's going to be a higher chance. That makes sense because as we age, our physiology changes.
Yep.
We excrete medications maybe not as quickly or efficiently, so the chance of getting a side effect is higher.
Females have a higher chance of having side effects, and there's no specific identification of exactly why this is, but likely related to hormonal differences.
The next one is increased alcohol use.
Okay.
Makes sense because increased alcohol use can interfere with your liver function.
Yep.
Liver dysfunction can interfere with the metabolism and excretion of a medication, so that can increase the chance of side effect.
And that kind of ties into people with pre-existing kidney and liver issues. So because of the way that this is processed, if you have pre-existing issues, this can aggravate those.
The last one would be if you have a history of hypothyroidism or ALS. For some reason, those conditions also increase your chance of a side effect. Okay, so those are the risk factors that you might have
to get a side effect.
A side effect, and we're finally going to get to the side effects.
Okay, so the number one that you'll hear from someone that's taking a statin is talk about muscle issues, and this is muscle soreness, muscle fatigue, muscle tiredness. And this can be from mild to severe and is present in up to 5% of people. Like, this is a very real thing. Now, you were kind enough to share that you have taken or are taking a statin.
I'm on a statin.
Do you have some of that?
When I started the medication, I did feel like I had some muscle aches and pains. Now, and I wasn't sure if it was, I was working out. Did I change my workout or something? Is it the nocebo effect? Just because I knew that was one of the side effects. So of course, I felt like, I got muscle aches and pains. Who knows? But I did. Right now, do I still feel it? I've been on statins for about a year. No, I don't think so.
Okay.
But it's hard to tell because if I change my workout, then I do feel muscle aches and pains. And would I have felt those if I wasn't on the statin? Who knows? And
rarely can lead to something that's life-threatening. It's something called rhabdomyolysis, where the muscle breaks down, and because of one of the components of the myoglobin that goes to your kidneys, it actually causes kidney failure. So it's very rare, but it's also very serious. So if you do have significant muscle symptoms, talk to your doctor and definitely be assessed so that they can decide what to do.
Okay, next one.
Number 2.
Liver damage.
Yep.
Okay, you can damage your liver by taking any medication that is excreted by the liver. For example, acetaminophen. Excessive doses of acetaminophen can lead to liver damage.
Yep.
Well, same with a statin, right? Excess doses or being on it for a while can damage your liver. And that's why you'll see if you get started on a statin, some of the blood work that your primary care physician will order is to look at your liver function to make sure you're not hurting your liver by taking it.
Right. Okay, number 3 is elevated blood sugar and transitioning into even borderline type 2 diabetes. So because of the way that sugar is metabolized and the role of the liver and the role of cholesterol in this can potentially cause this problem. So obviously, like Paul said, once you're taking these medications, you're going to be having regular blood work that include blood sugars to find out whether or not that it has changed in you.
Okay, and the next one. What's the next one again? Oh yeah, memory loss and confusion. See what I did there?
I did see what you did. I can tell. See, I can never tell if you do that on purpose because sometimes you do that normally.
Because I'm on a statin.
Now, I feel like you did it before you're on a statin. I feel like that's a nocebo effect.
Think so?
You just demonstrated.
Is it a nocebo effect or an excuse?
Yeah.
Cousins. Those are cousins.
It is a fine line.
Okay, so memory loss and confusion. And that's a weird one because a lot of studies have suggested that being on a statin can help reduce your chance of developing dementia because of keeping the blood vessels, patent in your brain.
Yep.
But listed as a side effect is memory loss and confusion.
Right. So now you know who's at risk of getting statin-related side effects. You know the top kind of 4.
Oh, and the last one.
Oh, what's the last one?
Memory loss and confusion. No, I'm just kidding.
You know the top 4 side effects that you do get. The take-home message is, yes, medications have side effects. This one has some very specific ones that are not particularly uncommon. If you have concerns about them, please do not stop your medication abruptly on your own volition. Talk to your family doctor, your cardiologist, discuss this, and have a plan to deal with your other medical issues as a whole.
Yeah, and keep in mind that the risk of these side effects are very low.
Yes.
So the overall risk-benefit profile of statins is, we think, quite high, based on the evidence available to us.
Yep.
However, there are some controversies that exist with taking statins, which we've talked about in other videos.
And a recent article that we're going to review pretty soon.
Yeah, that shows that maybe the benefits aren't that great.
Yes.
So definitely talk it over with your doc, with your cardiologist before you make your decisions with this medication and any medication.
I feel like the cholesterol issue is not quite solved yet.
No, it's not solved
quite
yet.
solved.
No, smoking, that one's solved.
Yeah,
right? Smoking is bad for
cancer,
you.
bad.
That's a good one that showed that.
I feel like alcohol is getting closer to being solved.
I'm bringing it back.
That's right.
I'm bringing it, keeping it
but
on this
cholesterol
side.
is certainly still up in the air. We're trying to figure it all out. And just for us, for the viewers that are watching, we just want people to be healthy. So if that means eating different stuff or exercising or taking medication, we just want you to be healthy. We have nothing to gain. We're not in the pocket of big pharma.
No,
the statin people aren't giving us checks every month. No one is, for that matter. So we just want people to be healthy. So we're trying to provide the information for you to make an informed decision.
We are not sponsored by dark green leafy vegetables.
Right.
We are not sponsored by your coronary arteries.
Right.
We're not sponsored.
It is what it is. So if you like this video, please like it, subscribe to our channel, share it with someone, and leave some comments talking about your experience with statins. And I think we're going to be overwhelmed with comments.
Remember, Sharon is Karen.
No. I think Karen is a negative thing. That Karen is like a statin nowadays, unfortunately, for people named Karen.
It's not
sorry, fair, Karen. Those people. How did that even happen?
Yeah, sorry, Karen. Please don't ask to talk to.
Your name is Karen. Leave a comment.
Yeah, don't ask to talk to the manager.
That's right.
Remember, you are in charge of your own health, and according to the nocebo effect, you are partially in charge of some of the side effects that you perceive.
See you next time.